morning, everyone. Thank you, organizing committee, for giving me this opportunity. Here I am presenting clinical and etiological spectrum of the third, fourth, sixth, and seventh cranial nerve palsy. It is a hospital-based cross-sectional study. So as we know, third, fourth, sixth, and seventh cranial nerve palsies cause significant neuro-ophthalmic morbidity. Global incidence are 15 per 1 lakh and 11.3 per 1 lakh, sixth nerve, and third nerve is 15 per lakh. Leading cause are microvascular ischemia, trauma, and neoplasm noted. So aims of this study is to evaluate clinical profile, etiology, demographic of the patient of third, fourth, sixth, and seventh cranial nerve palsy, identify association with risk factor diabetes, hypertension, trauma, and pattern of isolated versus multiple nerve involvement. And secondary objective was assessment of the anatomical localization of the nerve lesion. These are few patients which we have included: sixth nerve palsy, third nerve palsy, and multiple cranial nerves involvement. So this is hospital-based cross-sectional observational study conducted at tertiary level hospital of the Central India. Ethical approval and consent were taken. 30 patients were included, which were more than 18 years of age. Isolated or combined third, fourth, sixth, and seventh cranial were included. Exclusion criteria were congenital palsy, prior intervention, incomplete record, myasthenia gravis, thyroid ophthalmopathy, myopathies, and multiple sclerosis. Consecutive sampling of eligible patients were done and diagnosis confirmed via detailed history and comprehensive ophthalmic and neurological examination. Demographic data were included and ophthalmological examination best corrected visual acuity, color vision, ocular motility, diplopia, charting, ptosis, ocular alignment, and anterior segment examination, corneal sensation record, and fundus examination, facial nerve evaluation, and other neurological assessment were done. So here we noted third nerve ptosis, mid-diasis, and ophthalmology as sign and symptoms, and fourth nerve vertical diplopia, head tilt, and in sixth nerve horizontal diplopia and esotropia. Additional investigation where there is applicable X-ray, B-scan, CT, MRI, CSF analysis were done, and imaging of localization, enhancement, and anatomical involvement and statistical calculation were done. These are the results. As we can say, there is a mean age were 45.2 and male preponderance were there. And in seventh nerve, we have observed that there is a distinct etiological pattern with the trauma and inflammatory causes being more common in younger patients. In contrast, microvascular and ischemic etiology were frequently observed in elder patients. The highest incidence was observed in 40 to 90 group. Bell's palsy was identified as the most common. All cases were treated conservatively, and exposure keratitis was noted in 42% cases, and detailed statistical analysis shown significant association between age and etiology. And third, sixth cranial nerve palsy, there was a 33.3% of cases, and etiology was trauma, meningitis, vascular in third nerve cases, and multiple cases we have observed 10% of patients, and headache occurred in 2 patients, and there is a etiology were cavernous sinus thrombosis, ophthalmoplasia, and cavernous sinus involvement. So most common palsy was seventh nerve, majority due to the Bell's palsy. Sixth nerve palsy was the mainly trauma with the raised intracranial pressure. Third nerve palsy is strongly associated with the diabetes mellitus due to the microvascular ischemia, and multiple cranial nerve palsy is most common due to the cavernous sinus thrombosis followed by diabetes, unilateral involvement observed in all cases. So anatomical localization, seventh nerve, lower motor nerve involvement seen, subarachnoidal in sixth nerve space, and third nerve subarachnoid space and cavernous sinus was noted, and multiple in cavernous sinus involvement was seen. So our finding align with the global data in some areas, such as the dominance of the Bell's palsy in cranial nerve 7th, and however trauma emerged as a major cause in the cranial nerve 6th, which may reflect regional factor. The strong link between the diabetes and cranial nerve 3rd palsy emphasized the need of the metabolic control. Cavernous sinus thrombosis remain a critical diagnosis in multiple nerve involvement. So the strength of this study was prospective and comprehensive evaluation, and there was a small sample size. And so I conclude this study as a cranial nerve 7th palsy was most common with Bell's palsy, and cranial nerve 6th was often trauma related. Third is shown strong ties to diabetes. Cavernous sinus thrombosis was key in multiple palsies, and these insights can guide clinician in early diagnosis and systemic evaluation, ultimately improving patient's outcome. Thank you so much. These are references.
It's a good study with limited sample. That is your drawback, that it does not have enough sample size.
Yes, sir.
See, in any study earlier, before 2000 and all, the sample size was not very important in drawing a conclusion. But after 2000, they realized that nearly 1/3 of the papers published before 2000 had inadequate sample size, and therefore their conclusion need not be applicable. You understand?
Yeah, right.
So for oral presentation, these are okay. But if you want to take it for presentation in a paper, it's important always to calculate the sample size.
Yes, thank you.
Yes?
So
Good.
in continuation with what Sir said, in that case, then you can treat it as a case series rather than a study, because then you're still allowed to report it. And also sixth nerve is known to be the most commonly affected
Very
for trauma.
common.
Can you say why? Can you tell us why?
Microvascular causes. Due to diabetes, microvascular causes.
Trauma, you said.
Yeah.
Sixth nerve is most common for trauma. So why is that?
Yes.
Why? Ma'am is asking why in trauma sixth nerve is commonly affected.
Because it's because of location actually. So, or head trauma and orbital trauma, it may induce.
Is there any particular reason you have excluded certain conditions like myasthenia, multiple sclerosis? Was there anything in the mind why you have excluded those conditions?
Because there is a systemic correlations, so we didn't evaluate this. We mainly focus on the ocular involvement and ocular causes.
Okay.